Hi, I'm Dr. Bomer. Welcome to my anti-aging series. Today we're going to talk about Botox and the family of neuromodulators. As we no longer just have Botox, we have two other products that have been FDA approved in the 2000s, Dysport and Xeomin. So now I want to explain to you how Botox works on a microscopic level. And so the way it works is you inject it into the area that you want to reduce the strength of a muscle, and it works at the neuromuscular junction. And so there's a nerve that comes in and say this is the muscle, and when the nerve releases acetylcholine, which is the neurotransmitter, from the nerve ending, that molecule travels across this distance called the neuromuscular junction and attaches to the muscle and makes the muscle contract. And the way that Botox and Dysport and Xeomin work is so you have the product injected in this area where there's the muscle. It is absorbed into the nerve ending, and in the nerve ending it actually has a very specific chemical reaction where it cuts a certain molecule in half. And when it does that, it makes it so the nerve can no longer release that acetylcholine. It can no longer release the neurotransmitter, so the muscle's not going to be able to contract. And so it depends on how much you inject, and how big the muscle is, what degree of weakening you're going to get. So you can get partial weakening and you can get complete weakening, depending on how much you inject in correlation to how many neuromuscular junctions there are, which correlates to how bulky the muscle is. And so that is the microscopic way in which it works. And then after that has happened, so we've had a chemical reaction in the nerve ending, it is no longer Botox. It is now broken apart into little pieces of protein, and those protein pieces are released from the nerve ending, and then they're released through our kidneys and our liver, and they're out of our system in about 3 weeks. And so the effect continues in terms of the weakening of the muscle for a while. The typical time period for the effect is, complete effect is around 1.5 to 2 months. Again, it depends on how much you've put in. But typically we like to wait and have a strong enough injection so that the periodicity that one needs to inject again is about 3 to 4 months. And there's never been an instance where the nerve does not recover its ability to release the neurotransmitter again. So in that time period, the nerve regenerates and it then starts releasing the neurotransmitter again, which is why you start getting function again. And so what's nice to know is if you get this injection, the active components of what Botox and Dysport and Xeomin are, once they've had the full cosmetic effect, which is about 3 weeks, it is no longer active in your system and is excreted from your body. So now I've talked to you about how the Botox works microscopically, and now I want to show you how it works aesthetically, how it works macroscopically. How does it work for us, and why do we like it? Okay, Emily is so kind to have let me draw it on her face. What we have drawn here is the muscular striations of the different muscles that are targeted with Botox, Dysport, or Xeomin. The forehead muscle, as you can see, the striations are vertical, and so when Emily contracts her forehead, go ahead and lift your eyebrows, you can see that the wrinkles are actually perpendicular, the opposite, exactly the opposite direction to the striations of the muscle. And so the forehead muscle, as you can see, lifts the eyebrows up. Relax now. When we apply the Botox or Dysport or Xeomin, which we're going to refer to those as neuromodulators, they're going to decrease the strength of this muscle, and she will no longer be able to, lift again, to do this as strong. Now, if I put a very large dose of neuromodulator in this area, Emily will not be able to lift her eyebrows at all, so relax, and relax all the way. And there's a base tension in the muscle. There's always a base tension in the muscle, kind of holding the brows in a certain position. If I were to completely take all the function of this contraction away Emily's eyebrows would actually drop. And that is typically something that women really do not like when they have Botox injections, if they feel like their brows are very heavy. It also doesn't look natural. It tends to look like a really glassy forehead. It looks really shiny and gives no movement to the brow at all, which doesn't look normal, and other people can pick up on it. So that's one of the ways in which it can be abnormal, is if it's just overdone. Another way, so raise your eyebrows up. Another way that it can look unnatural is if the whole muscle is not addressed with the neuromodulators. Say we just make this part weak, which a lot of injectors like to do, just this central part. So then when you lift the brows, what will happen is this will stay down and glassy, but then this lateral part will lift up. And that is what we would refer to as a Spock eyebrow, where you get a really strong peak laterally and nothing going on centrally, and that doesn't look natural. And we're going to show you a picture of that along in the video at another place. Okay, relax the forehead. So that's the forehead muscle, and that's a very common target zone for the neuromodulators. This area is called the glabella, and we've got the corrugator muscles and the procerus muscles, and you can see their direction. Now the corrugator, now Emily has had neuromodulator probably about 6 weeks ago, something like that. And so it's starting to wear off, which is normal. And so furrow your brow. You can see she's not very strong there, but if she were very strong here, this is the contraction of this muscle, the corrugators, is this direction, and when you get wrinkles from that, they're perpendicular again, so they go vertical like this. So you get these vertical lines here for wrinkles. And the procerus is a central muscle that goes this direction, and some people are very strong in the procerus, some people aren't. Everybody's a little bit different in terms of the ratios of strength with all these muscles. And somebody who's very strong in the procerus is going to get a wrinkle that is horizontal like this, which is very common in men and also some women. And so when we address this area called the glabella, we are addressing the procerus muscles and the corrugator muscles, which is going to help those wrinkles, the vertical 11 lines from the corrugators and the horizontal wrinkle from the procerus. It not only addresses wrinkles, but it also gives lift. So as you saw, when this muscular complex is contracted, contract again, Emily's eyebrows go down and now lift up again. When she contracts her forehead, her eyebrows go up and relax. So when we weaken the forehead muscle, she can no longer lift her brows as high and as strong. When we weaken the downward contraction, we actually will get lift. And this is how we can use these products to help position the brow and try to create symmetry between the two brows. Okay, relax completely.
And the orbicularis muscle,
which is the muscles around the outside of the eye. It actually goes all the way around, but these muscles dominate in this zone. Do a big smile. And you can see how when those contract, we're also getting a contraction in the cheek, which is different muscles down through here. So they all work together. The muscles are going to tighten, pull this lateral brow down right here, make little wrinkles in through here, and also give little wrinkles in this area here. And relax. And so this is another area that we address with neuromodulators called the crow's feet area. And there's different ways to inject this. I feel it's important to be careful in this zone, because if this is addressed too aggressively, smile again, it can affect the elevation of the cheek here, which is very beautiful. And when this doesn't elevate, it makes the cheek look a little bit strange. So I'm very careful in this area. But to get a brow elevation, it's very nice to lift the tail of the brow. This is an area that gets heavy on a lot of us, and we also get deep wrinkles here. And so keeping the injection up in this zone for the crow's feet is really nice to get a lift to the tail of the brow and also help the wrinkles that happen, again, perpendicular to the muscle. And let's go down to the lower face. This is an area that we commonly inject here with my method. And the upper lip, often we get the vertical lip lines, like this, from pursing our lips. Go ahead and do that. And that's giving those vertical lip lines. And relax. The muscle in this area is a circular muscle like this. It's actually quite thick and robust. And what we're addressing with neuromodulator is just that superficial aspect of the muscle that is connected to the skin, and weakening that part of it ever so slightly so that when at rest, there's not that base contraction in the lip borderline, and we can help improve some of these vertical lip lines. And it particularly is helpful for prevention as well, that we're not having that robust skin tightening and repetitive bending of the skin that causes the wrinkles. This area is called the, it's a Depressor Anguli Oris muscle, and what it does is it turns the corner of the mouth down, so go ahead and do that contraction. And here we can see its contraction right here, and at the same time, the chin contracts upward. And so all of this leads us, this is a contraction that we do regularly, you can relax, and it tends to, as we get older, lead to a mouth corner that goes down and a chin crease that is deeper right here. And so we do this complex often together. The chin is addressed for reduced contraction in the upward direction. It also helps smooth it out because often we get sort of a dimpling effect there. And then an injection here to reduce the contraction downward. These areas, when they are injected, are only done lightly because we really still want that function to happen. It's just a softening. Same around the eyes, this is a softening of the contraction. In the glabella area, it really is often good to try to get that contraction almost 100%. When we can't contract here, the outside public doesn't recognize it, they just think that we're relaxed and happy. The forehead, in my opinion, it's important that we have some mobility of the brows and that the brows are elevating in a natural way, so raise your eyebrow. So we really must address, and everybody's forehead is kind of like a fingerprint, is very different. And we must address every area where the forehead is contracting and do it in such a way that when the brows raise after this muscle has been weakened, that it's just reduced, so to kind of do a half contraction, you know, that we can't lift it quite as high, but there's still mobility and we've still reduced how strong it is, but it looks very natural, and all of that is very important. So that's kind of a nutshell of, you know, the goals with the Botox and how it works on each muscle group and how important it is to achieve aesthetic results. You really need to analyze these muscles in each person, as they do vary from person to person. And so now we're going to go on to some muscles that aren't done all the time, but they are done often in my practice. We've added some muscles here. These are the bunny, we call them the bunny. These is a nasal muscle that has a contraction here on the side. We call them the bunny lines, so do that contraction. And some women and men, but more women, do this contraction very strong and leads to these wrinkles along the side of the nose, which again are perpendicular to the muscle that go like this. And relax. And so this is an area that can also be addressed with Neuromodulator and effectively reduces that contraction and then is helping to fight those wrinkles. We have muscles in the area here that's called the Masseter. This is a mastication muscle. It's a muscle that we use very strongly for chewing. And in certain people, this muscle gets very big and it distorts the shape of the face. So on a woman, if we're too big down here, it looks masculine and squares off the shape of the face. And so it's really nice on women like that. And often women that are very big here will have symptoms from grinding their teeth. They'll often have a mouth guard. You know, there's often other things going on than just the sight, just the aesthetics of it. And so when we do some neuromodulator in the masseter, it reduces the size. However, it's not going to affect the ability to chew. There's plenty of other muscles that are involved with chewing, and we're only decreasing the strength of this, not taking it away completely. And the effect of that size reduction happens because not as many fibers are firing, and you actually get reduction of muscle, the size of the muscle fibers over time. And that's very effective for improving the shape of the face. And then finally the neck, the vertical neck. So this is the direction of the platysma muscle, and when we contract it, we get these vertical lines here, and relax. And we can actually weaken the strength of this muscle and reduce some of these platysmal bandings. Now, it doesn't work if there's a lot of laxity, if their skin's really, really loose and it's hanging it doesn't really effectively help us with our bands because it's just too loose. But it's really great on somebody like Emily, somebody like myself, somebody who doesn't have a lot of laxity. It really helps to promote a nice angle to the neck and reduces the strength of the contraction and reduces the propensity to get the neck bands. It's not perfect, but it's definitely a big help. So that's pretty much the examples of how one uses neuromodulator in the face for aesthetic reasons. And so now I want to talk to you, we've got the 3 different neuromodulators. We've got Botox, we've got Dysport, and we've got Xeomin. Some injectors have just decided to stick with the Botox, that's what they knew, and they just didn't even jump into the new products. I was encouraged to try to determine what is the difference between these products. Is there any difference? There are some physicians that would argue they're all the same, and I would argue that they're not all the same. We do a lot of analysis here in my practice. I like to really understand how products work and how different techniques work. So we do a lot of before and after photographs, which is important for not only analysis of my own work, but also for patients to see what has happened to them. And so what I found with my experience with the different products is that Botox is more focal. And so what that means is where you inject it is where the effect tends to stay. It does that, the effect of the Botox where you inject it tends to stay close to the needle point where you put it. Dysport is really different in that when you put Dysport in a zone, it will tend to spread a little bit from that point that you injected. So spread of effect is a bit broader with Dysport. And Xeomin is in between. Xeomin spreads a little bit, but it doesn't spread as much as Dysport does. And so what I like to do with the maximization of all these products is to use them so that we get the best aesthetic result in the face. So for example, the forehead is a big, broad muscle, and I find that Botox will have a tendency, because it's so focal, you inject it all around, but it will have a tendency to have certain areas of the muscle not addressed. Certain areas of the muscle that are still contracting that you had wanted it to soften. So Dysport does a better job at giving you a much more, in my opinion, natural look with the forehead because it has that spread of effect. You're able to get a nice smooth application of the Dysport without complete weakening, so you still are able to contract the muscle. But when you contract the muscle, it looks more natural, it's more even, you don't have any focal areas that are really strong and another area right next to it that's weak. And Xeomin, again, is more in between. We really like Xeomin in areas like the lip and the corners of the mouth because it spreads ever so slightly, which makes that, again, you want some softness to it, but you don't want it to go too far and seep into other muscles in the area. So we found Xeomin to be very great in this area. So ultimately, I think it's to our advantage to have these different products and to understand their activity in the tissues and how they work differently. It is also helpful to understand that for certain people, we really want to, like in the glabella, we really want something to be very focal, because they have a certain type of anatomy, and then there might be other patients who in the glabella the Dysport is going to be a little bit better because of their anatomy, just having a little bit more spread. And the effect of the two is interesting that the Botox has more of a flattening effect of the tissues. It really kind of makes tissues look flat, and Dysport actually plumps the tissue a little bit. So I tend to gravitate towards Dysport on people that are a little bit more thin and bony, and the Botox up in the area around the eyes for people that are a bit more fleshy. But these are just some of the subtleties of my technique and how I've learned how to use these products over the years. So we've gone through and learned a lot about Botox and the neuromodulators, and I thought it might be interesting just to understand my history with it. I've been injecting Botox since 2002. And I soon thereafter started injecting myself, and I feel that anything that I do, whether it be surgery or an injection, that it needs to be analyzed and understood completely. And it's been great to be able to inject myself and as well as patients, and seeing a lot of before and after pictures and learn how the products work and how we can utilize them to their maximum to achieve a result that is truly natural looking, that when you're out in public, if you've had these products put in your face, that they're actually maximizing how you look, that you look better, but you don't look altered, you don't look artificial, you don't look different. You just look better. And that's the subtlety, the art of being able to understand the science and then put that together with how each individual face differs and use the products to their maximum, the Botox, the Xeomin, and the Dysport, and the advantages with respect to their spread versus not spread, and the differences between each person's anatomy, and putting this all together to really achieve that when you're out in public, nobody will know what's going on, that you just happen to look great. And it's been really fun for me to extend this service to more patients by educating other doctors and nurses how to inject. And that's been my focus lately, is that transfer of information. Dr. Bazookas, who has been in practice with me now for several years, he has now been injecting Botox for 6 years. I trained him in my techniques, and he understands obviously the Botox, the Dysport, and the Xeomin, how to use those to their advantage as well, and the analysis and all of that. And it's been really exciting for me to be able to teach this and see somebody else understand how to do it as well, and analyze each patient and give them the results that they can achieve that are very natural. And now the focus is going to be to bring more nurse injectors to the public so that we can offer these services more broadly to a broader patient base, and also at a little bit lesser price so that it's more accessible for more people to have the advantages aesthetically of the neuromodulators and also feel confident that they look natural and better. So I just talked about going out into public and looking natural and feeling confident that you've gotten the best aesthetic benefit from the injection of a neuromodulator in your face. And so I want to go on to show you an example of an aesthetic effect from Botox that I find unnatural and unattractive, and then also describe to you a result that I think is a very nice result. All of this is to a certain degree opinions. I'm giving you my opinion and showing you an example of what my opinion is, and that it is really ultimately, your judgment that matters the most, because it's you out in public, you getting pictures, and you need to decide what you think looks the best.
And this appears to be an unnatural application of Botox in the forehead, where you see the central forehead very glassy and not moving, with the central brow being quite low, and the lateral brow elevating to a very high place and creating an overall unnatural appearance to the brow when it is raised. In contrast, you can see a before and after picture here of Emily with her raising her eyebrows. In the before picture, she has full strength to her forehead, and the after picture is about 3 weeks after a neuromodulator injection with my method. And what you can appreciate is the shape of the brow upon raising is about the same in the before picture and the after. This is a natural brow raising for Emily, because you can see this is how her brow raises when she elevates her forehead. Everybody's brow raised position is a little bit different, and that needs to be addressed with the neuromodulator injection so that the lifting of the brow is maintained in a natural position upon elevation. This is another picture of Emily before Botox on the left and after the neuromodulator on the right, and you can appreciate that her brow is in an elevated position but still looks very natural and has also brightened her eyes. This is a picture before and after, before on the left and after on the right, of one of my patients with full face neuromodulator, and you can see in the after that her eyes are somewhat brighter, her brow is elevated, and she overall has fewer wrinkles in the forehead, between the eyebrows, and around the eyes upon smiling, but she still has retained a very natural appearance.
So I hope you've learned a lot about Botox, Dysport, and Xeomin, and how these products could potentially help you in terms of reducing wrinkles and improve your aesthetic appearance. And we're really excited here at Rejuvent to have trained other people with my technique, Dr. Bazookas, and now a nurse injector, so that we're able to extend this wonderful transformation that can happen in the face to a greater population. So thank you for joining me, and have a great day.